Let's talk about 10 actionable steps that you can take to maximize your weight loss goals and success when taking medications like Wegovy or Zepbound, which are GLP-1 agonist medications. My name is Dr. G, and I'm an internal medicine physician in Hollywood, Florida. I'm also a lifestyle medicine expert using lifestyle modification coaching and weight loss to help patients change their lives. Here are some of the tips I've developed while consulting on over 300 patients a month for lifestyle modifications and weight loss. First tip is, if you're going to use the GLP-1 medications, you better take some time to understand the meds. Do some research on the medications. Understand what their indications are, meaning why you should be on the medications, and what some of the contraindications for the medications. It also gives you an idea of what you should expect while you're on the medications if you know how the medication works. In this case, we're talking about a medication that lowers blood glucose and decreases your drive to eat. Basically, it's what's called satiety, something in your brain that tells you, hey, you shouldn't eat this anymore. And this is because of the GLP-1 agonist and how it works when you inject it. Understand that knowledge empowers you to make informed medical decisions and also gives you the power to understand how the medication will work before you put it into your body and get ready for the side effects. And sometimes you can mitigate the side effects if you already know what's going to happen, basically. For instance, constipation. If you know constipation is probably something that you will suffer from, you can start your fiber or other measures to counteract constipation before you actually have the constipation. Tip number 2 is to be patient and follow the dosing regimen. One of the craziest ways I've seen people wreck their lifestyle modification journey is by being impatient, especially with GLP-1 agonist medications. People come in through the door all the time telling me stories about how they skipped doses and went on to a higher dose, chasing more weight loss from week to week. And inevitably, those are the folks that come into the office telling me about how constipation ruined everything for them. They got super nauseous or they threw up. All these other side effects that we typically do not see here in the office because we make sure that our patients go low and go slow on the medications here in the office. So making sure to be patient on your lifestyle modification journey, especially when you're using GLP-1 agonist medications, is super, super important. Tip number 3, understanding that you should be consuming food for nutrition and prioritize protein. Big problem when you are connecting your pleasure with food instead of, connecting nutrition with food and having a secondary pleasurable experience. Pleasure in food, those are, innate, those are natural responses to receive pleasure when eating something that you really like. But when it becomes a problem, when you are now eating for pleasure instead of eating for nutrition. So mindful eating, making sure that we understand why we're sitting in front of the plate of food we're sitting in front of and making sure we're hungry when we're doing so. And then secondary pleasure from that plate of food is the way to go. Mindful eating means taking time to slowly eat your food. Don't be on the phone, you're not on television, you're not excessively talking with even the person across from the table. You are taking your time to savor every single bite, the textures, the flavors, everything that comes along with eating a good meal to improve your relationship with food. And also, it has been shown that mindful eating helps with keeping you fuller quicker. Mindful eating is important. Second part is to prioritize protein. Prioritizing protein in your nutrition on a GLP-1 agonist, just about on any weight loss journey. Protein is one of the most important macronutrients, I believe, in your weight loss journey for a couple of reasons. One, you want to feed your lean muscle mass as you are increasing your exercise and resistance training. And you also want to make sure that you are using protein as the macronutrient that's going to fill up your stomach and get you to reach satiety quicker and for a longer period of time, which will increase your weight gain, which will decrease your caloric intake and increase your weight loss over time. So when we say prioritizing protein, we mean to prioritize nutrient-dense foods like lean proteins, whole grains, legumes, vegetables, and healthy fats. those are the types of foods that you want to make sure that's part of your core of your nutrition. And as we prioritize protein, we also want to avoid excessive sugars and excessive ultra-processed foods. Tip number 4, staying hydrated. Staying hydrated is absolutely important on anyone's lifestyle modification journey, whether you're trying to gain weight or lose weight or maintain weight. Water is necessary for a lot of small biological processes that are necessary to make the body run efficiently. When you are dehydrated, you also can run the risk of running into one of the other lesser known and lesser occurring side effects of the GLP-1 medications, which is dehydration, which then can cause kidney problems. So acute kidney failure is a side effect, or a very rare side effect of the medication, when you restrict yourself from, drinking enough water. So hydration, hydration, hydration. Tip number 5, remember to incorporate a regular exercise routine. Starting an exercise routine is challenging, I get it, but it's absolutely necessary to get the body going in order to increase your caloric burn and increase your weight loss. It'll make it a lot smoother if you get to moving that body. We want to get 150 to 200 minutes, ideally, of exercise activity on a weekly basis. I like to start by recommending 10 to 15 minutes, just a brisk walk, first 2-3 weeks if you're starting from sedentary. And then after that, maybe getting up to 20 to 30 minutes by the second month while you're on the medication. Halfway through the second month, you start resistance training, body weight exercises to increase your lean muscle mass. Of course, you're doing protein from day one, and you're watching your ultra-processed foods. You're increasing your fruit and vegetable intake, keeping fruit about 5 different servings a day. It's a lot. Tip number 6, setting realistic goals, but setting challenging and realistic goals. It's important to set a goal no matter what you're doing. It's kind of hard to go on a lifestyle modification journey if you haven't set a goal of where exactly you're going. You can't map out a journey if you don't have a point B. So it doesn't have to be a huge weight loss. It doesn't have to be a huge change in your numbers or a feeling. It just has to be something. So set up small goals along the way, very important, small reachable goals, but set a challenging but realistic goal so that you're not feeling like you are failing or feeling as though you just didn't do enough or it doesn't work for you. You want to make sure that the goals are doable, but at the same time challenge you a little bit. No matter what the goal is, it's absolutely important to track progress. I can't tell you how many times patients come in here and tell me that they haven't gotten on a scale in years or months or some amount of time, but they are on some sort of lifestyle modification journey. I do get it, and I do understand that not everything happens on the scale, and that's something that's super, super important to understand. But if you are on a weight loss journey, it makes sense that you should be tracking your weight. If you are on a feel better journey, then yeah, you're gonna track how well you feel. And I'm talking about track it, write it down. If you're, maybe you don't wanna get on the scale, but you should track it. Let's say, put on your favorite dress, a dress you haven't put on for years and years, no longer fits you. You wanna get back into that dress. You won't jump on the scale, but you'll watch your body change over time until you can fit into that dress, knowing that's around about where you wanna be weighing anyway. Just an example of how you can track your progress without doing something that you may feel that causes you some anxiety or triggers. Tip number 7, getting enough sleep and managing stress. Now, I like to say to my patients, hey, if you aren't getting enough sleep, it's like never rebooting this computer. You can't leave it on forever and ever and ever and ever and expect that it's going to work efficiently forever. That's not how it works. You need to give your body time to shut down, your brain to go into sleep mode, and to start to recover, repair, and get ready for the next day and the next challenge. Same thing with stress. If you're not managing stress correctly, you can cause a myriad of problems, including cortisol levels that are increased and causing insulin resistance and metabolic dysfunction at the level of the liver and the gut. So understanding that you should manage your stress and get the proper amount of sleep. When we say the proper amount of sleep, we mean about 7 to 8 hours, somewhere in there, a night. Sleep hygiene, stay away from the phone, keep the room dark and without any noise, lights all the way off, shut the shutters. Do all you need to do in order to make sure that you're sleeping enough every single night or day, depending on what your schedule is. Tip number 8, do not ignore side effects. Side effects are going to show up. You're putting a medication into your body and you're dosing it to the point where you're not as hungry as you normally would be. That in and of itself, it's an effect. It's not a side effect, it's the desired effect, but it's an effect. So it only makes sense that if you're pushing the medications to that point, that it's very possible that you can end up with one of the other side effects. And side effects are basically effects of the medication, but unwanted ones. And the most common ones are nausea and constipation. Sometimes you'll have hypoglycemia, meaning low blood sugar, and that's usually owed not to the medication per se, but typically because you not very hungry and not eating enough. And we have to actually eat food for energy. So do not ignore these things. Bring them up to your practitioner, bring them up to your doctor, bring them up to whoever is watching you and keeping you and observing and supervising this lifestyle modification journey that is aided with prescription medications, and knows what they're doing to help you to get through these side effects and make sure you can stay on the medication without any severe issues. Tip number 9 is one of my favorites. Get support. Get people on the squad. Get them helping you out. Let them know about your journey. Let them know that you are trying to do something. If they see you maybe straying away from the beaten path on the straight and narrow, you need them to go ahead and help you with some truth and love, of course, to get you back on track. Also, that means you can do things like join my online community or an online community or a community around you that have like-minded people that are on the same journey. It is infinitely easier to go on a lifestyle modification journey in a group or a community setting, which is why I started our online community. And we talk about all types of problems. We share our wins there. We share things that we know and things we understand, different recipes. It's a pretty awesome community. And I'm sure there's one around you. If not, you can join ours. But anyway, make sure that you find a support system, no matter what that is, that can help you along the way. Lastly, tip number 10, making sure that you check in regularly with your doctor. Here at my office, I kind of force everybody to come here every single week for accountability and also for support from the office. And we follow labs periodically to make sure that everything is going well. Kidneys are working well, the liver is working fine, that the thyroid is still working intact. Everything, the blood glucose is perfect, because you don't want to cause another metabolic issue with these medications being on board and being injected and not really notice that, you know, the kidneys are failing or the liver is failing or something's happening and you didn't know. So that's one of the best reasons that I can give you for being monitored very closely by a doctor like myself who understands how to use GLP-1 medications and how to do all the lifestyle modification coaching that is necessary in order to be successful for the long term. So those are my favorite 10 tips. Those are the 10 tips that I've developed over time that I see that are most effective for patients on GLP-1 agonists here in my office. Of the 300 plus consults I do a month and lifestyle modifications coaching that I do as well. So if you'd like to join our GLP-1 community, right now we have a special offer just for you. 7 days free of charge. Jump into the community, get all the benefits, see what it's all about, and maybe you'll want to stick around. Take a look at the link in the description below and take advantage of this free 7-day trial. I'm sure you won't regret it. It's going to be pretty awesome. Stay healthy, stay informed, and I will see you soon.